when I hear policies and announcements like this, I always have two measurements to go by. Is the plan or is the money that they're being proposed, is it going to be helpful? And is the plan going to work? And obviously, investing in training is going to be helpful, of course. But when staff are leaving faster than the staff are being hired, that leads me to think that the plan is not going to work. And we've had these incentives before. And of course, money is also always welcome, and people and the new PSWs would welcome the opportunity. But you have to take a look at the recruitment also. Like right now, our members are telling us that even when those new hires come in, there's still 50% turnover of staff on an annual basis. So that means that for every 10 PSWs working today, 5 of them will be gone by next year. And turnover among full-time staff is much lower, which is good, but part-time staff is much higher. And yet the part-time tend to make up over 60% of the workforce in those homes. So we know the ones leaving are the ones who've been working the shortest. They tell us they won't work in these conditions. So until we fix the working conditions inside the homes, it just continues to be a revolving door of retention and recruitment.
Pat Armstrong, can I get you to follow up on that in as much as long as the conditions are the way they are, we're going to lose more than we retain? What are the conditions being referred to? We
have long said the conditions of work are the conditions of care, and so it's about the residents as well as about the staff. And having a full-time job, as we just heard, is absolutely critical, and we're not changing that as far as I can see. And we need to have permanent part-time staff too. Everyone should have a secure job in this sector. We need to change a lot of other things too. In addition to pay, we have to change the kind of power that the people who work there have. These are skilled workers. They should have more say about their work and how much work they get to do and what kind of work they get to do.
What does that mean, more say? What do they need to have more control over?
First of all, they have to focus on tasks defined by somebody else right now because there are so few staff. Now, we're supposed to increase it to 4 workers per resident per day. That's a criterion that was set over 2 decades ago when we had far less complexity in terms of patients, or residents, I should say.
So that's got to be changed.
That has to be changed. It should be at least 6, and it should even be more when we have the most complex care required. And we have to change in terms of allowing the staff to decide what needs to be done in terms of providing care so that they apply their skills and can respond to the individual needs of the residents.
They don't make that call right now?
Well, not when you have to rush and do 10 things before the next resident requires something to be done. So you have to work nonstop. And years ago, we did surveys with staff, especially with PSWs in Ontario, who said that they couldn't get done what they needed to get done. And we need to do even more now.
Mm. You know you work with them all the time. You know the people who go into this line of work. What prompts them to go into this line of work in spite of all of the difficulties around it?
I think if you're a PSW, if you're a nurse, if you're a physician, anybody who's in the area of healthcare, we're drawn to it because we want to help people. That's fundamentally it. And people want to figure out what is the way that I can contribute the skills and really make a difference in people's lives. Fundamentally, I've never met a PSW, a personal support worker, who doesn't actually want to do the best they can for that individual. The challenge is what Sharleen and Pat have said is Pat's, famous quote, is Dr. Armstrong, who's said, the conditions of work are the conditions of care. When you actually don't allow people to actually have good, stable jobs, and this dynamic about part-time versus full-time work. Why so many part-time workers? Because you don't necessarily have to pay them good benefits. You don't have to give them all the other things that we would do that, say, nurses or other people working in hospitals have more secured, more full-time employment and benefits. So when you don't give people proper paying jobs with good benefits, when you actually don't give them good conditions, they're always working in short-staffed situations. It's a recipe for disaster. And that's why Sharleen's saying, you're more likely to lose more people than you gain in a given year. And it's a revolving door. So it's great there's more money to train more people, but just so they can leave in 6 months? No. We want to basically train more people and give them good work so that they can provide good care.